Hello friends, welcome back to allornonelaw. And this is a medical video lecture and today's topic is RNA viruses. And this is really very important for USMLE step 1 examination. Okay guys, so let's classify the RNA viruses. So RNA viruses we are going to classify into the two important classifications. That's double-stranded depending on the RNA content in the virus, so whether it's a double-stranded or a single-stranded, right? So remember, most of the RNA viruses are single-stranded RNAs, right? So in a double-stranded RNA we have, whether we want to know whether it's enveloped or not, so it's naked. Most important is the naked one, that is medically important RNA virus. And in this category we have what we call icosahedral shaped viruses, that is icosahedral, and the examples for this category are Rio viruses. Rio viruses. So which are the viruses included in this group? Rio virus, rotavirus, and orbivirus. Rio, rota, and orbivirus. So you know very well that rotavirus is the most common cause for gastroenteritis in children. That's a really very important, most common cause for the diarrhea in the children. This is a really very important virus. Okay, and what's the treatment? Is it just self-limiting, give ORS, maintains the electrolyte and the hydration status of the infant. That's it. Okay guys, so single stranded RNA I'm gonna talk in a different screen. Single stranded RNA, we got three things in it. Okay, so we have whether the positive sense, we have a negative sense, then we have ambisense and negative. Ambisense and negative. Okay, so in a positive sense, again we're going to divide whether it has an envelope or not. Okay, it's enveloped, okay, env, enveloped, or it's a naked. Okay guys, so in enveloped we have different shape, that's icosahedral or helical. Icosahedral or helical. Okay, helical, right? So in icosahedral we have very important three main family viruses known as flavivirus. Okay, in icosahedral, flavivirus, toga virus, and retrovirus. Okay guys, and retrovirus, right? In a flavivirus, the important viruses for USMLE is yellow fever virus, yellow fever. Okay, yellow fever virus, right? Dengue virus, very important. Sorry, I'm just, okay, let me do here. In a flavivirus I'm talking about. Okay, then we have what you call St. Louis virus, St. Louis. Okay, hepatitis C, very important. Hep C. Okay, right? Tell me, Hep B belongs to which group of viruses? It's a DNA virus. That's a hepatinovirus, right? Yes. So let's talk about this. And in a toga virus we have what you call, in a toga. In toga virus we have rubella. Congenital rubella syndrome is a really very important topic for USMLE. Then we have western and the eastern equine viruses, not medically important or USMLE. Okay, then Venezuela virus. Try to forget, remember about the rubella virus, really very important. In a retrovirus, very important, that's HIV, human immunodeficiency virus, HTLV. Okay, Then we have sarcoma. Okay guys, so this is about the RNA single-stranded positive sense enveloped icosahedral viruses, right? In a helical, over here, we have one virus, that is a coronavirus, right? Coronaviruses that caused SARS, right? Severe acute respiratory distress syndrome, right? SARS, respiratory syndrome. That was very, I think, epidemic in the year, I don't know exactly, maybe around 2020, 01, or I don't know exactly. Okay guys, so this is about the coronavirus. So let's talk about the naked virus of positive sense single stranded RNA in a different screen. Single stranded, then we have positive sense, then we have naked, right? In naked, we have two types of viruses that are important. One is the calcivirus, and we have another one is a picornavirus. Remember, the naked virus here is the icosahedral only, no helical shaped. Icosahedral. Okay, right? Picornavirus. In a calcivirus, most important is two. There is a Norwalk virus, and hepatitis E virus. Okay, in a picorna we have polio, enteroviruses. Then we have hep A. Okay, then we have Coxsackie A and B, then echoviruses. Okay, then we have rhinoviruses, right? So these are the important picornaviruses. So picornaviruses are icosahedral, naked, positive sense, single-stranded RNA viruses, right? That's the definition. So if you remember this chart, this is really going to be very helpful for your USMLE step 1 examination. So let's move on to the negative sense viruses, negative sense single-stranded RNA. So we have only one, there's no naked over here, so there's enveloped only. Enveloped viruses. Okay, so in here 4 important categories. One is a paramyxo, or let me talk about over here, the shape is helical. Okay, so we have paramyxo, right? Then we have rhabdo, then we have filoviruses, then we have orthomyxovirus. Okay guys, so in a paramyxovirus we have very important viruses. They are mumps, measles, and RSV, respiratory syncytial virus, very common cause for bronchiolitis in the children. Okay, from 6 months to 5 years. So what's the treatment? Symptomatic treatment. Okay, and a para-influenza virus. Okay, para-influenza virus. Right, in a rhabdovirus we have rabies from the saliva of the dog or bats. Then we have vesicular stomatitis, forget about that. Then filovirus, not important for USMLE. Then you can remember Marburg or Ebola, Marburg. Okay, then we have orthomyxoviruses, segmented viruses, and influenza viruses. Segmented virus A and segmented virus A and B of influenza viruses. Okay guys, so really very important for USMLE step 1 examination, RNA viruses. are divided into single stranded, double stranded. In a single stranded, positive sense, negative sense, and ambisense and a negative. In negative sense, we have enveloped, helical, and in that category we have four viruses: paramyxo, rhabdo, philo, and orthomyxovirus. Okay, guys, let's move on to the another one, that is the ambisense and negative. We have enveloped, then we have helical in this category. Then we have two important, that is arena virus and Bunaya virus. In arena virus, we have Lassa fever virus, Lassa fever virus. Okay, guys. In Bunaya virus, we have California virus, hantavirus. California virus and hantavirus. Okay, guys, so these are the important classification of RNA viruses. We divided into double stranded and the single stranded RNA, and the most of the RNA viruses are single stranded RNA viruses. Thank you so much for watching this video. Take care.